Today's clinical pearl will be discussing pelvic floor toning. Have you ever experienced the unintentional leakage of urine with physical activity such as running or jumping? Or maybe when you sneeze, cough, or laugh? Urinary incontinence is a common problem that affects millions of people for varying reasons. The social, physical, and psychological impact is significant. Unfortunately, there is a non-surgical way to address this. Passive pelvic floor muscle training using electromagnetic field energy is used for the treatment of urinary incontinence in both men and women. It may also contribute to the additional benefits in intimate health and wellness by increasing blood flow. The treatments are non-invasive, patients can remain fully clothed, and they can sit comfortably while pelvic floor muscles are optimally stimulated. Pelvic floor toning, PFT, is a treatment series that can address the most common types of incontinence: stress, urgency, and mixed incontinence. When urine leaks out when you cough, sneeze, laugh, or during physical exercise, this is stress incontinence. This is related to your pelvic floor muscles, one of them being called the urethra. Stress incontinence is pressure on the urethra, the tube that connects to your bladder and allows you to empty urine from your body. When the bladder fills with urine and the pressure on the urethra is too much for it to stay closed, urine will leak. A weakened or damaged urethra may be due to vaginal childbirth, bladder damage from surgery such as a hysterectomy, and men can experience stress incontinence from surgery with the removal of the prostate gland. Neurological conditions and medications can also contribute to stress incontinence. When you have a sudden urge to pass urine, this is likely urge incontinence, and the muscles of the bladder can seem overactive. There are specific muscles that contract and relax to allow your bladder to fill and relax, so you can empty your bladder. If these muscles contract too much, this is known as overactive bladder. Some of the things that can contribute to an overactive bladder are too much caffeine or alcohol, concentrated urine from being dehydrated, neurological conditions, medications, and constipation. The PF Toner has specific programs to treat the muscles involved with stress incontinence, urge incontinence, and the mix of both. Here's the clinical pearl for the PF Toner. The chair offers simplicity and ease of use. Patients may need to shift their position slightly to fill the muscle engagement. Sitting comfortably with knees apart helps improve the stimulation of the pelvic floor muscles. If the patient isn't feeling much stimulation, have them shift in the chair to find the right positioning for them. Always make sure that they have their feet flat on the floor, and sometimes they may need to sit forward just a bit. The second pearl is that the applicator can be used with and without the optional chair to treat different vectors. Well, that's all that we've got for today for our clinical pearls. If you have any questions or want to learn more, stay tuned for more clinical education pearls or reach out to our team. Thanks for watching.